Alrighty, everybody, thank you so much for joining us for today's uh, Pathways to Science and Medicine workshop. This is our second workshop, and we are so excited to have four panelists. So on the right side is our agenda for today. I'll be taking a couple of minutes to talk about Pathways to Science, and then we will have introductions with our panelists, followed by Q&A, and then closing remarks. So briefly, I wanted to share our Pathways to Science and Medicine mentoring program, and this will be a pilot where we will have at least 8 students paired with mentors from MGH, Harvard Med affiliated hospitals, and postdoctoral fellows. This is the proposed timeline for spring 2023, where we will have our Menti application deadline this December 23rd, the matching mid-January, followed by the kickoff in late January and early February, and then a wrap up in May. So this will be a 5-month long program for the spring and also for the fall. This is a brief information about what the program will entail. So again, it's 5 months and you will be connected with 2 mentors, and the time commitment will be between January to May, and then spring, and then September to December for the fall. This is just a quick facts about the program, and followed by the responsibilities of the mentors and also the mentees and what the program will entail. So basically what you'll be talking about with your mentors. So you can talk about like networking, interviewing, work-life balance, CV, anything that you and your mentor will decide on. It's pretty flexible, but we will provide loose guidelines. That way, that will help with the relationship building and also make your meetings productive. Here is an example of the application, or at least parts of it. So for those who are attending today and who will be watching this later on, an application of about 300 words as to what your motivation is to applying for the mentoring program, and also what your expectations are, followed by your, if you can update your resume. That will help us then find a really good mentor, or at least a mentor that would be a good fit for you. So we will send out those emails or a link to the application form after this workshop, and we can then provide more information on the website for you. So for today's workshop, I'm really excited and really grateful to these 4 panelists, Sabria, Ni, Kimia, and Felipe. They are amazing with their unique experiences. And so Bria, I actually work with at the center, at the Vincent Center for Reproductive Biology, and she is an amazing clinical research coordinator. She has great insight in terms of how to go about with working with patients and communicating with patients, and also being in the lab. Kimia and Felipe, I work with at the Postdoctoral Association at Harvard Med and at MGH, and they are both amazing resources and mentors. And Ni, who is our Bunker Hill Community College alum, and her pathway is really unique in that she started as a STEM major. And it's really, I think it's really important to bring in different perspectives, because you could start as a STEM, but not everybody here might stay in STEM. So I think it's really important to also see okay, STEM is a great field, but sometimes there are students who might feel like, oh, it's actually not for me. And so I think it's really great to hear different perspectives in that sense. So I will share my screen now, and we'll hand it off to Suma to moderate the introductions and the Q&A. Thank you all for attending.
Yes, so who will listen this recording later, and I want to mention a couple of things. You have lots of opportunity, Bunker Hill student, internship, fellowship, jobs. This is very unique opportunity. This is more like our panelists, and many other panelists will come in 2023. they are successful, but they have a story. They started from where you are now, after high school, maybe community college or undergraduate, and right now where they have a path. So the whole concept of science and medicine and pathway to science and medicine means it's a motivation, it's a guideline, it's a roadmap for you, so that you can ask question if you have any confusion, if you have any dream, if you have any hope, you can get there. So these are the people in front of you who are doing clinical research, who are doing in Harvard Medical School postdoc, who are in Dana-Farber Cancer Research Center. So if you think about, this can happen. So that's the whole concept of the mentorship program, pilot program. This is not we are giving you a job, but we are guiding you how to get there, to get the best job, to be in the community, in a higher education community. So that's the whole concept of this whole program. And thanks to Rose always, and it's her effort and the whole teamwork, MGH and Harvard Medical School Postdoc Association. So with that, I will, Bria Cooley, you can introduce yourself and say a few words to begin with.
Yeah, hi, I'm Bria. I work at the Vincent Center for Reproductive Biology, which is within the MGH Research Institute. A little bit about me. So I'm from New Orleans, Louisiana, but I graduated from Macalester College in Minnesota, which is a small liberal arts college. Just something that's interesting. I was really nervous about finding a job in science after graduating because I graduated with a BA and not a BS. And I realized that I guess people were really looking for BSs when I was applying for school or applying for jobs. And so that was something I was really, really worried about. But I'm here now at the Vincent Center for Reproductive Biology, and it's directly in the field that I want to be in. Hopefully I want to be an OBGYN, but if that doesn't work out, I'm also just interested in more clinical trials. So right now we're currently working on a study about bacterial vaginosis. Rose, can I show? I have my flyers from the
Yes,
study.
definitely. Yeah. Oh, Bria, I think I can't hear you. Oh,
Sorry.
there you go. Perfect.
This is one of the studies that we're working on currently. We've had these advertisements actually on the T, so maybe you've seen them before. And this is, I feel like I've learned a lot about gynecology just from doing this study. We're also working on an HPV study. So this is one of our other flyers we have. This one hasn't really started yet, but we'll start recruiting for it as well. And then the biggest study that my boss is doing right now, she's doing she's doing a vaginal fluid transplant from people who've never had bacterial vaginosis before, and to people who have recurrent bacterial vaginosis. It's really, really cool. She recently had an article in NPR about it, which I think it helped increase our enrollment because we've been struggling with the study. She calls this the cursed study because there's just been so many drawbacks to it. But if you're interested, this is the website for it. Dr. Mitchell, she's doing a lot of really, really cool research into the vaginal microbiome.
How about Nee? You can introduce yourself and say a few words.
Hello, everybody. My name is Nee, and I go with my little children would call me Miss Nee or something, just teachers. I graduated from Bunker Hill Community College in 2019, and after that I transferred to Wellesley College, and now I'm at Harvard Graduate School of Education. My final goal is to become elementary teachers in immigrants in a classroom with a lot of immigrant students. Yeah,
Wow,
yeah. Thank you for having me here.
sure. And
Yeah.
we'll have question for you later. How
Yeah.
about Kimia? Dr. Kimia Sarodi.
Thank you so much for the opportunity to speak with everyone. I'm currently a postdoctoral fellow at the Dana-Farber Cancer Institute. Prior to joining Dana-Farber, I completed my MPH at Harvard this past year. And then prior to that, I am an OB-GYN actually. So I'm a resident in obstetrics and gynecology from Canada originally. I'm out west in Alberta and completed my MD in 2019.
Thank you. Dr. Felipe Furtado. Did I pronounce correctly, Felipe?
Yeah, perfectly. Yeah, thank you very much for having me. So my name is Felipe. I'm an MD all the way from Brazil. Started doing research here at Harvard Mass General in radiology, studying cancer imaging, mostly molecular imaging for cancers using novel probes in 2020. So it's been almost 3 years now that I've been here, enjoying a lot so far. And I assembled a couple of slides to show my pathway. I don't know if I should bring them up or should wait till later. Just to show like how confusing pathway might be for the
Go for it.
students. Okay. Okay, so try to share my screen. And can you see my screen?
Yes.
Okay, perfect. So just gonna briefly talk about my long and winding road, my journey to where am I. So as I briefly introduced myself, I'm an MD from Brazil, doing postdoc here, radiology department of Massachusetts General Hospital. I'm also the co-chair of the mentoring committee. And this is one of the hats I wear. I also consult for a health tech company in Brazil, Medex, where we develop digital products for managing and coordinating healthcare. So how did I end up here? That's me on the left with a very bad haircut and oversized clothes. And at this point, I thought I knew I wanted to be a doctor somehow. And now, like some years later, here am I, and I don't know where to go from here. So it is confusing, and the reason it can be confusing for everybody is that the definition of success, people like looking backwards see it as a very straightforward, like a straight line. But in the end, the path you take might be very convoluted. You might go back and forth. And these 10 years since that the picture on the left I just saw from me as a kid to basically now, I've exposed myself to a lot of experience in different areas, and multiple times along the way I questioned myself. So I'll just walk you through like my brief jobs history to see like what you can do and what you can do to identify the things that you like and pursue them. So the first experience I had in undergrad in medical school was wet lab. I did mesenchymal cell culture from peritoneal cells. That was not fun for me. My experiments failed constantly. I had like this curse study background, so it was not for me. I knew that, but I just kept looking for things, and then one opportunity came out that I was doing clinical case translations for an app. I always working with technology, so that was fun for me. Then I joined a startup developing accessible lab testing in Brazil. I work with product development, the interface between medicine and business, and I knew I liked that. Then my first professional experience after graduating my intern year was in the intensive care unit. I saw a lot of suffering, a lot of deep hard times between patients and family members, and I knew that was a lot for me and a lot for everybody involved. So probably I didn't want to stick around that specialty forever in my life. I turned back to radiology, which I was a TA in med school, and then I had this amazing invitation to become a postdoc here, so I gladly accepted it. So it was nuts, but I did not see myself here 5 years ago, maybe even 4 years ago. You can go back and forth, but once you go back and forth and expose yourself to many experiences, you get a sense of what you like and what you don't like, and that's what's really important. So staying open to new opportunities and get a sense of what you like is a good framework to have in mind. Also, trying to align the things that you enjoy, compensate you properly, are beneficial to your work and your skill at. And in the end, the goalposts, they're always moving. The definition of success is not constant at all. So you have to focus on your values. That's what I would advise to people who are pursuing a career in science. It can be confusing. It's a great field with lots of opportunities and different roles to fill. Just try to seek your values, and to identify your values, skills, and interests. I like to share a tool that's helped me, and that's kind of quite standard for industry, which is the individual development plan. So I know this is being recorded, so people then can pause and scan this code and take you to the individual development plan testing. It's a free tool that will ask you questions, and you basically pick careers and fields in STEM, and it gives you plenty of options, and that will try to align your values, skills, and interests. So that was it. What I had to share. Thank you very much for everybody's time. I also would like to share my contact info. If people would like to reach out, I'd be glad to have a one-on-one chat if anybody interested. Thank you very much.
Thank you. Yeah. Any of the student who are here, do you have any question? Anything about their journey, about future? Please go ahead. I can see Elnor, Auror, and Nephthalem.
Okay, I have a question. So
Sure.
my question is like, what was the time frame to get where he is today?
That's me.
I think all of the panelists can answer. You can start. Yes.
Okay, so basically, I we do a different system. We follow like the European system, which is med school is and undergrad is the same. So we just get into med school straight from high school, and it's a six-year program. So I took 6 years from med school. Then I did 1 year of internship, and I'm in my third year of research. So that's basically 9 years or so after high school from where I am now.
Any other student, any question? Then I will ask panelists some question, and then as we discuss, people, you guys are here, and then lots of people, I hope they will listen later
Yeah.
at home.
I'd be curious also what the timeline is for Kimia, Nee, and Bria, and how
Right.
long, especially after high school.
I can chime in. So I graduated high school in 2011. So it's been over a decade now of one training after another. So I've done about 9 years of university, so 4 years of undergraduate degree, 4 years of medical school, and 1 year of my master's. In Canada, my residency, I am also considered a student. So I was a student there for 2 years. My residency in total is 5 years, and in addition to 2 years of fellowship training. So that's 7 years in total of residency after 9 years of university. And so right now as a postdoctoral fellow, it's the first time in a very long time that I have not been a student technically. So that's been interesting. I still feel like a student, but I think it is a long path, absolutely. I think one thing I would like to say about all of this, and I think finding what you truly enjoy and what is fun is so important to make all of this more sustainable and more feasible in a grand scheme of things. I think one of the reasons that I decided to take a break during my residency to do some of these things was because I realized that I wanted a career that was dynamic and included many things beyond clinical medicine. And I love research, and the thing that sort of drew me to medicine in the first place was my love for science. And so I love the inquiry process. And in an interesting way, that's also taken me to also consulting, similar to Felipe. And I think asking questions and looking for answers is something that's integral to not just medicine and science, but in many other areas where we can work to generate impact in those sort of, tangential but still highly relevant areas. So I think one of the things that I would say as sort of looking back on things, I think in the grand scheme of things, I probably had a fairly linear path. I would say I did a science program in high school and middle school. So since grade 6, I was in a science program, and then did the closest thing we have to pre-med in Canada, which is the health sciences program at McMaster. I did, however, specialize in global health and had a fairly liberal arts type education, but ended up doing my honors thesis in chemical engineering. So I had a little bit of divergence there. And then in medical school, continued with the global health interest, but also did some work again in engineering and robotics that time. So I kind of had these two areas of interest of working to increase equitable access to healthcare in different capacities, in different sort of sectors and settings, but also having this sort of keen interest in technology. And so it wasn't until my master's that I sort of was able to figure out how I wanted to do that, and started developing a medical device company, and also getting involved in some digital health spaces, which I think is an incredible tool for democratizing access to healthcare and also improving standardization of healthcare, and reducing inefficiencies in the system. So I think that's all to say that I'm a strong proponent of finding what interests you, and even if they don't really make sense. I remember trying to apply for medical school and having sort of this global health degree, but also doing research and engineering, and trying to make sense of that and trying to create that narrative, which I think is really important, and being mindful of your narrative and being mindful of what is the story that you want to tell, who are you in a sort of a very as existential as that sounds, but I think throughout all of this, you will be asked over and over again to tell that narrative. And I think it's really important to be mindful of that, and to work on things that you think contribute to that in many ways. It doesn't need to be in a very sort of traditional way, I would say, but finding things that that contribute to that narrative, I think, is really important. But I do remember being in my final year of undergraduate training and applying to medical schools and saying, like, what have I done? Like, none of this makes sense. I'm interested in tissue engineering, and I'm global health, and how do I make sense of this? But eventually it comes together. I think that's really important. These things did converge for me ultimately several years later. But I think that's also important to recognize that we don't always have the perspective we need to make sense of these things, and experiences are so valuable. So if there's something that's interesting to you, seek that experience, pursue that experience, and know that at the end of the day, there will be a way for it to come together, as long as, and I think the common thread that really needs to be there is interest. If you are interested in what you're doing, if you are passionate about it, it will make sense, because at the end of the day, the common denominator is you. So there must be a commonality there, even if it doesn't feel like it. So I think that's my big sort of takeaway from looking back on my own path to where I am today is the fact that as important as that narrative is, it can come together in very unexpected ways. But it does come together. I promise. Eventually. Takes time. Took me 10 years, but it does take time.
Yeah, if anyone has any student, 3 of the students joined us today, but I have one question on behalf of like Bunker Hill student. As you know, one side is the dream and hope and your interest, but any panelist can jump in. There is a financial burden always. Many of our students, they think, oh, how can I be MD? How can I go for PhD? because and I need to explain sometime that it's paid, the PhD program or master's program. I was a TA, I was a RA. So any input, any feedback, that is a fear. As you all know, we are in a community college, so they have the fear of the financial burden to move forward.
I
Um,
can, oh, sorry.
I want to add on that point. I was gonna ask a question, especially to
Sure.
Nee, because she was in Bunker Hill. So I want, like, you mentioned you went to Wellesley, so like I think it's a big school. And how did you manage the financial things? What kind of things did you do to make you, a more good, a better candidate for, like, to be accepted to that school and all the things?
Kima, if you want to go first, I think that you want to chime in first. Yeah.
Please go ahead.
Yeah.
Thank you.
So thank you so much for your questions. So finance and financial aid is something that, as an immigrant, low incomes, and then for gen students like me, I've been constantly thinking a lot. And to be honest, it's how, like, the financial aid package will tell me where I'm going. So I grew up in Vietnam. I moved here to America in 2016 with my family. So I've been living here for 6 years. Back in Vietnam, I didn't have any interest in science and STEM, even though I usually going to very selective school in my city. And then the kids there are crazy about science and math, and I don't see that I fit there, but I have to go because this is one of the best school in the city. So after high school in Vietnam, I spent 2 years in marketing because I feel like, oh, I love literature, I love English, I love writing, and I love the fancy part of it. But then when I come to America in 2016, and the very first evening in America, my extended family sat me down and talked about what you have to study, what I have to study. And then their narrative is about what earn the most money, what jobs can get you the job, what professions that can get you the job immediately after graduation. There's not about passions, not about interest. I'm sorry, I don't want to like create any Asian minorities narrative here, right here, but
Indian is the same, by the way. Yes.
I know, right? It's just Vietnamese people, they sat me down and was like, okay, you go for nursing, or if you can't go for nursing, you go for accountant. And I was just like, these people don't know me, because if they know me well enough, like my parents, they would never ever tell me to study those things, because I'm so terrible at that. But then, I just came here, I had no money, and I also want to support myself and my family. So I chose to study. I chose to go to Bunker Hill Community College and take a lot of science courses, and hope that I can get to a nursing program in the state. And unfortunately and fortunately, that I took those science courses and I met wonderful professor. I took an introduction to biology's honor course with Professor Dunphy. She's graduated from Wellesley College. She had someone from Mao Ho-Yuk College and a lot of others, women's liberal art, historically women liberal art college, and they come and talk to us. And that she encouraged me and a whole class to apply there. And a lot of, as far as I know, liberal art college, it's particularly women liberal art college, they had a lot of funding, and they have a program for adult students. Some program, especially for Wellesley College, you can apply only if you are more than 25 years old. So they have a different transfer applications process for us, and a very huge package, financial aid package. And that's the reason why I chose to go to Wellesley College. They get, I can be very honest about a number. I pay less than $15,000 for 3 years at Wellesley College, and it must be cheaper than the money that I have to pay even when I go to a state university. So that's why I chose Wellesley College. And then when I finished Wellesley College, and I'm pretty sure that I want to be a teacher, I applied again. I met wonderful professor at Wellesley College to push me hard to apply to Harvard, which sounds really crazy for me that now, even when I'm at the school, I walk on the campus and I was just like, huh, am I here? Do I belong here? Because like, there's no part of me feel like I'm just good enough. I'm just extraordinary. I'm just excellent enough to be with other people. Because like English is not my first language. So sometimes I make sentences that doesn't make sense. And I was just like, oopsie, sorry, but I'm here. So, and again, I got, as I check all the list of, I'm an immigrant, low income, first-gen student. So I have half of the financial aid package from Harvard, and the other half, it comes from my Wellesley College. At first, it only gave me just a little money, and I called him and was like, no, you can't do this to me. Because like, you know that how much money you give me will decide where I'm going next year. So they constantly work together to give me more funding. And I have to say that I am now at Harvard Graduate School of Education for free, thanks to funding from Harvard and thanks to funding from Wellesley College. So that is just a very like pinpoint part of my stories. When I was little, I always wanted to be a teacher. Always wanted to be a teacher. My parents sent me to after school daycare, and then I'm just pretended to be a teacher there every single day. Like I pretended to be teachers. I brought all my books to all the kids there, and I read books for them. No one listened to me. I still read. So I still wanted to do that. But then in the middle, there are so many things going on and I just forgot that. But then when I got to community college Bunker Hill, first to say that, I had the chance to work to join in Jumpstart. It's a nonprofit organizations where they send us to like a preschool in low income area. And we just stay there 2 days a week with young children. And I gradually think, this is actually what I'm good at. And this is actually my gift. So now I'm just coming back to become a teacher. But all the time, like even like for my story, I would just say like the questions like, do I belong here? It's very important to me. My parents didn't go to college. My dad got a GED from evening classes in Vietnam and almost dropped out, but thanks God he did not. But the thing is that I didn't know what college means when I got to high school. And science and STEM and medicine, especially medicine, is often comes with privilege, racism, and sexism too. That sometimes I'm thinking for myself is belonging. The sense of belonging is something I'm thinking for myself. And I'm trying to creating that environment for the students that I'm working with. Because like, when I was little, and a lot of my students right now, they're low income and they're immigrants, they have no idea what scientists do. And scientists must come from someone who knows everything. And I just don't know anything. So I don't feel the sense that I fit in any situation here. Even when in my college graduation, I was just like, oh, I did that. That is cool. But I feel just, I don't know if I'm a real one. And then like my mom and my dad tell everyone, of course, they tell everyone I go to Harvard. And then I was just like, can you not stop doing that? I don't feel like I'm the real one. I'm a fake Harvard here. So it's just like, yeah. So I think those programs like the panel that we have running right now, a mentoring program, is so helpful and meaningful for those like me, my brothers, and a lot of my immigrants and low-income students. Yeah, and in the end, I do belong here, even though when Dr. Guzman sent me a message on Instagram and I was just like, huh? I'm not sure that I'm the right candidate for this. But somehow I feel like I do belong here, and I just want to share that you belong here too. Yeah.
Thank you. Bria, go ahead. Thank you, Nee.
I just wanted to say that I didn't go to community college, but I come from a pretty poor background. And coming from New Orleans, most of the high schools there are failing. So I was really lucky to go to one of the best high schools in the state. But and that's part of the reason I got accepted into my college. They were saying like, we know your school is really high, your GPA might not, or really hard, your GPA might not be that high, but the school that you came from is extremely hard, and we know that. I only got accepted into 2 schools for college. One was UC Dublin, and I kind of regret not going to that school because if I had went, I'd already be a doctor. Because they have the 6-year program similar to what Felipe was talking about. But the college that I went to, I didn't have to pay for anything. Macalester College is a really, really good school when it comes to offering its students financial aid. So I had a humongous grant that I was given from my school, and 2 or 3 different scholarships that they had also just given me. So when I came out of school, I didn't have to pay for anything. I have like a few FAFSA loans, but hopefully with the student loan debt cancellation, I wouldn't have to pay anything either. And so I actually am really grateful to my college for that. I support the private liberal arts colleges because they do really try to help their students out when it comes to financial aid, similar to what Nee was saying. But I also think that that really changed my path where I'm going with medicine, because I graduated in 2021 and I'm still trying to figure out if I want to go to med school, what I'm going to do with that. And I really like research, and my PI, she currently does research and she's still a gynecologist. She's in the clinic actually right now. So that's something that I hopefully aspire to be like, but we'll still see. But just like in terms of finances, I would definitely look into the liberal arts colleges. I think that not only do they help a lot with financial aid, but you get a better one-on-one experience with your teachers than you would at a big, large, either private or public university, since like the teacher to student ratio is much smaller.
Yeah, definitely. Kimia, you are saying something. Yes.
I think those are such important points. I also had a remarkable amount of funding throughout all of my training. So my Harvard degree was also paid for, and so was my undergraduate degree. The one thing I will say about all of that, though, is if you see scholarships, apply. Don't get into your head of oh, I don't think I'm good enough or anything like that, because you are. And I think it's one of those things that I think every single scholarship that I was fortunate enough to receive, I did not think I would get. And that goes to show that you never know, and know that there are people who maybe don't have the same credentials as you, but have the confidence and will apply and will get it. And so be the person to apply. Don't, and when it comes to writing applications and whatnot, find someone who has had that scholarship before, talk to them, seek help, seek mentorship in that process, because know that other people are doing that. And these are the advantages that comes with being in the system. So having either family members or essentially being in a network and understanding where these connections come from. In medicine, one of the things that constantly troubles me, I guess, is that 50% of my class had at least one parent who was a physician. Neither of my parents are physicians, but I think that tells you a lot about understanding the system and how much of a difference that makes. I think with things like LinkedIn and ways that we've sort of increased transparency of what people do and sort of histories, take advantage of that. Look at what other people have done who are in positions that you want to be in. So similar, exactly like this, where we're openly talking about what we did to get to the points that we are at, take note, and figure out for yourself what that can look like. And don't sell it short, and apply and apply and apply for scholarships, because someone has to get them, and that person could be you, and it should be you. And so,
Yeah.
and I think that's a big part of it, is that those very large merit-based scholarships, I trained in Canada, so I don't know them here, unfortunately. But the ones in Canada are, I now sit on the selection panel for one of them, and we make a point of looking at holistically our applicants, and recognizing that someone who who's had to work part-time jobs and in order to support themselves in these processes will not have the same list of extracurriculars as someone who didn't have to do that, but that doesn't mean that they are any less qualified for that scholarship. And I think recognizing that scholarship committees are doing that, and they do understand, hopefully others will as well. The fallacy of meritocracy is what I think is so true, is that we look at that what is merit in society, and we fail to understand the context in which that all happens. So recognize that these things do come into play, and recognizing that the person who is able to do research and maintain a reasonable GPA and work a part-time job is an incredibly functional and competent person. And that is incredibly valuable. And that is someone you want in your program, you want as a colleague, who is able to have the skill set and the work ethic to succeed in any setting. So I think these things are so important when moving through these different stages of career development.
Mhm. Yes, Philip, I mean, it's very interactive and nice discussion, but we are kind of going to the end part. So Philip, I have a quick question. So you picked a very interesting subject, radiology, imaging, and I see the abdominal imaging. My question is, did you plan for that? How long, or it just interests you when you joined the medical school? What's the specialty? How it came up with that particular field? It is a fascinating field, by the way, the imaging.
Well, thank you for the question. Yeah, I didn't plan. Like I mentioned, that things happen like by accident. I stumbled upon things and I just pursued my interest. I like radiology as a whole in medical school. So and there was a teaching assistant opportunity, so I applied for that. Ended up doing full semester of teaching assistantship. Really enjoyed the field, and then had an opportunity to come here to Harvard for an clerkship, elective clerkship, and then did multiple rotations and met my current PI at the abdominal radiology department, and we've been working together since.
Fantastic, yes. Aurora, do you have any question? I know he has to go to Elnor. Do you have any question, Elnor? We'll wrap up soon. So if you have anything in your mind, you can ask without hesitation.
Well, my question is,
Yes.
To get to the medical school from like a 4-year degree, right? How was that whole process? How did you keep your mental health like in check during that period of transition?
I can answer that. So I think I did go to essentially a pre-med program. So 85% of my class went to medical school after. So I was, again, this is one of those things where understanding the system has a lot of advantage. And so being among peers who had similar goals, it's very easy to see, I shouldn't say easy, but it's apparent sort of the steps you need to take to reach that point. And so I think in terms of mental health and maintaining just overall wellness during that process, it's challenging. It's challenging for many reasons. It's a competitive application. You're not entirely sure. It's in Canada, it's about 7% acceptance rates. So it's far from a sure thing. And you're in many ways having to put all of your eggs in one basket. And one of the downsides to having a pre-med program is my degree is useless otherwise. I did a degree that has very little other transferable skills. So I think that was one of the factors that does apply a great deal of pressure to the process for sure. I think when considering applying for medical school, my big suggestions are grades, at least in the Canadian system, definitely do matter. So be mindful of the courses you're taking. Look into med school application requirements early on so you can be mindful of the courses you need to take, and mindful of sort of maximizing your GPA. And again, these are the things that people don't talk about, but everybody does. So maximize your GPA, take courses that are, the ones you have to take, but not the very hard ones, so that you can do well. And I think going through the process, again, finding things you like doing, make sure you take time for those things. If it happens to be, I personally am not a musical person, but I had many classmates who were, and so joining the school musical was a very common thing that I think a lot of people did. Finding a sport you enjoy doing, but finding these things, and they do find, and again, these things find their way back, and they come up in interviews, and they come up in. So I think it's very easy to think that, you need to study and do research and this and that in order to get into med school and or to do whatever. But I think these other sort of, again, maybe more tangential things also always have a role. When you're interviewing for medical schools, they'll ask you, when was a time that you had to work in a team? It doesn't have to be an academic team. You can talk about the time that you put on a musical production. You can talk about these other things. And as an applicant, it actually makes you more interesting. If you're the person who can say, I have these other interests, I was able to maintain this GPA, and I was able to do this. And also I did these really fun things, and I'm an interesting person, and I'm a nice person, and you want to work with me, you want to get to know me. And I think that's really important in the process. So I think taking time to do things that you really love, managing your course load to be smart in terms of maintaining your GPA, your mental health. It does not make you any less of a student if you are taking easier courses. No other people are doing it, and they're just not telling you. And so it's, I think, recognizing that there are all of these sort of facets in play when applying to medical school. And the way our GPA is calculated for application to medical school, it's often cumulative. So even your first year courses do matter, unfortunately. Some programs are kinder and will weight them less because they recognize that the first year in particular is a big transition. But GPA does matter, definitely.
And MCAT score and volunteer also.
Exactly.
If you volunteer in ER and other places, that would be great. Yeah.
I would say, and I think again, I'm a very strong proponent for finding things that interest you. If you volunteer in the ER but have absolutely no interest in the emergency department or emergency medicine, that will come through in your application and in your interview, and it does not look good. So find things that interest you. If you were a kid who was always, doing sports and spent a lot of time in the emergency department, as I did, and you can talk about that and say that I liked volunteering in the emergency department because I got to see the other side of it and whatnot, then sure. But I think there's a lot of things that, unless you're able to contextualize some of that experience, give it meaning, it bears little weight on applications later on. And again, it goes back to creating that narrative. Think of who you are, what you want to be. And I think it's really challenging to do that in a very long-term way, unless you see somebody in that position. So some people are fortunate to have parents or siblings or whatnot in that position. Not everyone does. And so I think finding ways to gain that insight is really important, because it will help you contextualize your experiences a little bit more. Just as sort of a side note, I'm not doing med school applications this year as a reviewer, but a friend of mine is. And I can say that a lot of the questions that they're trying to get at now is more so around looking at those factors of like, sure you did this, but why did you do this? And what does it, and how can that translate later into a career in medicine? That piece of how can it translate, that's challenging, because I can tell you that until I was a resident, I didn't know what medicine was. Until I was a physician myself, I didn't fully comprehend that. So that is a very challenging thing to do. I think it's a little unfair to applicants to expect that, but you can imagine, you can extrapolate as best as you can, talk to as many people as you can, talk to your family doctor, talk to, you know, anybody you can find if that's what you're interested in, to get a sense of that, because it helps to understand that if in medicine it's important to be up to date on research and information, for instance, then maybe if I'm doing this right now, that connects later on, and creating those kind of connections during medical school applications is always helpful. Challenging, but helpful.
Mhm. Rose, we are almost the last couple of minutes.
Yeah, we're towards the end. This was an amazing and fruitful conversation. Honestly, thank you so much. Thank you to all four of you, and thank you, Suman, for moderating. We are coming to an end, but we did record the session. Please feel free to email us if you have any questions, and if the panelists are okay with being contacted, or if you have any questions, we can forward your questions to them. So at the very end, I'm just going to share my screen really quick just to share more about the mentoring program, the pilot mentoring program. So again, we will send out a follow-up email to all the students who attended today and the past workshops. And basically, I think Suman has like a list of students, over like a couple hundred students that he can forward the information to.
Yes.
So we will be accepting, this will be a pilot mentoring program, just because we want to make sure that we are creating a solid foundation, and we want to start small first, and then we can increase the size in the fall. But this will be a pilot program with at least 8 students. The application will be due December 23rd. We will send out the link to the form next week. We have a website now. Because this is a new program, it's taken us a while, but we will have a website where students can go and apply. It has all of the information, PDFs of what the program is, expectations, and then the application, of course. So we will kick off the program the week of January 30th, and then it will last from January 30th or February until May. So that will be something to keep an eye out on. And again, I really want to thank you to the panelists for coming today. And we really value your time and you sharing your experiences. This was really, really fruitful. And I wish we had more time to talk. But yeah, I just really want to thank you all for coming today and sharing your experiences, talking about financial, and like really, I think like we really talked about like real topics that not many people are comfortable talking about. And I want to also thank you to the students for asking these questions, because financial questions are difficult. Like, where do we even get those information? And so, yeah, I just want to thank you all so much. I appreciate your time.
And I wish more and many of students will listen to this. It's very motivational. Yes.
It is.
Yes.